Washington State, Adam Smith. Sir, with a big welcome to you, I'm curious if you expect this bill can be changed enough to pass.
It's a difficult needle for the Republicans to thread because they've got the conservatives who don't like what it does, and you've got the folks who are trying to moderate it. So I don't know. It's hard to say. I mean, it's really sad the way they've approached health care, which is simply to be against Obamacare and not to be for anything, because all the plan that they're doing does is takes health care away from a bunch of people and throws our system into even more chaos. Look, Obamacare worked in terms of adding a lot more people to the rolls. What we need to focus on is how do we make cost control work. I don't see anything in this bill that's going to make cost control better. So, whether they pass it or not, I think health care in this country is in a very, very bad place.
And interestingly, sir, an NBC Wall Street Journal poll suggesting that the majority of Americans do not like the Republican health care plan. There's a Quinnipiac poll suggesting only 20% of American voters are likely to vote for someone who supports the revised health care plan. So what does that suggest to you and how Democrats can make it work for them?
Well, I'll give you a slightly different answer. Look, the problem with the health care debate, and I raised this issue when we were passing the Affordable Care Act with the Obama administration, is very few politicians are actually honest with the American people about the choices that are involved. I mean, nobody's worse, obviously, than President Trump, who says we're going to have a plan that's going to cover everybody, it's going to be cheaper, it's going to be great, it's going to be perfect for everybody. Well, that's not the way health care works. In order for everyone to be covered, you have to take into account the fact that people who are older or sicker are going to get priced out of the market unless you make people who are younger and healthier pay more, unless you put various systems in place to ensure that healthcare companies can't cherry-pick healthy people or cherry-pick people in certain categories. That's why you require a minimum benefits package. That's why you require it to cover pregnancy. And you say, gosh, I'm a 58-year-old single man, I'm not going to be pregnant. But the point is, you got to put everybody into the pool in order to make it affordable. If you allow people outside of the pool, the people who are healthier or less risky, then the costs for people who fall outside get prohibitive. That's what pre-existing condition is all about. And the thing most people also don't realize is pre-existing condition, it's not, okay, these are the people with pre-existing conditions. Everybody is vulnerable of getting one. You can have a child born with a horrible disease. I mean, simply getting old puts you in a position of having a pre-existing condition that makes you uninsurable. So to make this work, to get costs under control, some people are going to have to pay more than they would on a simple open market. But you pay more now so that hopefully when you get sick or you get old, you can have affordable health care. That's the balance we have to strike. And I don't hear what I just said hardly at all course of this health care debate. It's all about, well, they're taking insurance away from people, or Democrats want government to run it. Look, health care policy is complicated for the reasons that I just stated and many more. We need an honest discussion about it, and then an honest bill that gives us the best chance. Look, America does not have the best health care system in the world, and we haven't for quite some time. We need to look and learn from what other countries have done that are actually doing a better job of providing health care to their citizens for a lot less money. But that requires an honest conversation.
Yeah. Well, Congressman, your thoughts certainly are honest. I thank you for sharing them on that, and we could talk a lot more. But I do want to get to the bill that you introduced this week aimed at getting the Department of Defense to come up with a strategy for dealing with Russia's aggression. Politico is reporting today that the Trump administration is debating whether to withdraw from an international treaty signed by Reagan and Gorbachev in 1987 that bans an entire class of nuclear missiles. What's your reaction to that?
Well, that's sort of a minor side issue. Well, not a minor side issue, but the Russians have been in violation of that treaty for some time, so how we handle that is important. The larger issue is the fact that the Trump administration flat refuses to acknowledge even what Russia is doing, much less that it's a threat. And it's just embarrassing that President Trump finally came up with a position on it, and that is, well, if it happened, it's Obama's fault. He's been president now for 6 months. He's come up with no strategy whatsoever. In fact, as you mentioned earlier, most of the time he says the whole Russian thing is fake news. What my bill attempts to make clear, it is not fake news. What Vladimir Putin and Russia are doing is a clear threat to our country, our democracy. It's not just our election that they meddled in. They're meddling in elections all across Europe, Eastern and Western Europe. They're also creating a lot of fake news stories in order to drive policies that they think are advantageous. The whole situation between Qatar and Saudi Arabia and the States, in part was kicked off by a speech that the foreign minister of Qatar supposedly gave that was inflammatory to Saudi Arabia. Only the foreign minister didn't give that speech. It was something that was posted on the internet that was simply made up, and then people bought into it. These are the types of disinformation campaigns that Russia is running, and they are doing it to promote autocratic dictatorships and undermine democracies. And President Trump has steadfastly refused to even acknowledge that this has happened. So my bill says acknowledge it and put together a strategy for countering it.
Washington State Congressman Adam Smith, I enjoyed speaking with you. I'll look forward to doing it again.